here. All right, guys, we're I am just full of words and full of emotion and full of everything right now because I have one of my favorite people. I don't think I'm just struggling to even introduce you, Dawn, because I want to cry because you mean so much to me in so many ways. So people, I'm just really happy if you are here with us live. Give us a heart, let us know that you're with us. I'm going to try and monitor the chat while I'm speaking to the lovely Dawn. So if you see me looking down and you see in the light, it's because I'm on my iPad looking at the comments from you guys. And if you see the replay, also make sure to put in a heart because we'll keep seeing the comments and we want to send some love for Dawn. So Dawn, you're one of my favorite people. I hope you know that. I think I've known you for 6 years now, and you've been a good friend. We've been working together and we've been hanging out together in various ways. And one of the things that you and I talk about a lot is sex, isn't it?
It is. We do.
We do talk a lot about sex. And so I think, well, I could introduce you, but I'd rather actually you introduce yourself. Tell people a little bit about who it is that you are, apart from being my superhero friend.
Thank you. Okay, so my name's Dawn. I work as a clinical psychologist. I'm now in private practice in the UK. And predominantly use Zoom, so I still see people from overseas as well. And yeah, my work has changed somewhat. So I started my career in learning disability work and working with people with autism, and that's changed somewhat into more adult mental health and ACT training and supervision and those kind of things that I do right now. So yeah, I guess this topic has become a bit more prevalent in my work for a number of reasons. And yeah, then obviously you and I started having some conversations about that and thinking about how, about us as human beings, but also then about kind of clinical work as well. So that's currently where I'm at, I think.
I remember a specific situation where we were on a ferry and we were talking like very graphically about different stuff. And not until afterwards we realized like the people around us, because there were quite a lot of people around us, if anybody had listened to what we were saying, it would just been an interesting thing because we were really talking about, we're having a quite graphic conversation about our own desires and our own, pleasure. And yeah, it's just a very fun, it's a very fun moment. So you're not afraid to talk about sex, and that's it's so liberating and it's so inspiring to me, and I'm guessing to the people around you and the people that you serve. So Dawn, why do you think this particular topic is why are you passionate about the topic and talking about it?
It kind of feels to me like a layered thing. Like I started being interested in the topic before I was sexually active. So I was quite interested in what sex was and wanted to do a lot of learning about what sex is. So that's interesting in and of itself, because where do we learn about sex? Like our sex education is fairly horrific. It talked about how not to get pregnant, and predominantly male pleasure is what we're taught. And so that was really interesting to want to know more than that stuff, right? There was an interest, I think, there. And then a lot of my more recent kind of passion for this came from my clinical work. So working with people who were wrapped up in a lot of the societal norms about this stuff, so some people were struggling with even having a sexual desire, thinking that was wrong or bad or selfish or dirty, and also working with people who've been experienced sexual trauma. And so thinking about those people and how they were at times kind of very one of the things I really struggled with was a client who said to me, I've got to have sex with my new partner, otherwise he'll leave me. And I just thought, gosh, this isn't a topic I cannot have a conversation with her. And so we started to talk about that. And again, just noticing how frequently people are really just not willing to even use terms, like to label our body parts. And to the point where a professional that I heard on a podcast talked about being banned from Instagram because she'd said the word vagina in an Instagram reel. And actually, what does that say about us and our bodies and what we're allowed to do? And so thinking about how we can even start to have those conversations, never mind do complex trauma work, how do we even start to have a conversation? And so just this week, a client was trying to explain that she might have an STI. And she was like, oh, and I just said, do you mean penis? And she was like, oh, yeah. Oh, thanks for saying it. And it was just such a relief. And I said, it's cool. We can talk about sex. We can talk about body parts. And she was like, is that all right? And so just this giving people the gift of being able to talk about themselves as a sexual being, to be able to talk about their trauma in a real way, to be able to talk about their trauma recovery. And also, and I think you know this from knowing me so well, it's like life is more than just recovering from trauma, right? Like then we get into the spectrum of pleasure. Like how can we expand on what we do already and become our best sexual beings as well as our best non-sexual beings? And I just don't think that topic is talked about very freely or very easily. And additionally to that, there's my own sexual trauma, and just thinking about how my own experience and what that was like for me at the time, obviously, but also the narratives that it's left me with, and how I've managed that along the way. It feels really important to reflect on those things as well, and so that's probably fueled my passion, I think, in terms of wanting to provide other people with a space to really step into their true selves, and that includes being a sexual being for a lot of people. So there's a number of I called it this layering. I think some of that comes with my age, my experience, and the people you come into contact with in work. So yeah, there's a number of reasons I think why this feels like an important topic.
And I'm still blown away right now by you, Dawn, because first of all, because you are providing people a space to talk about this, to explore this, and to be normalized. But you're also, and I hope people saw this, being very self-disclosing here, talking about your own sexual trauma. In fact, this was, I saw you recently in a workshop in San Francisco, and this is how I felt about it. I felt this was one of the best workshops I've ever attended, where you did a workshop together with your partner, and you both started out sharing something that is very personal, very traumatic, and absolutely heartbreaking. And would you be willing now to share with us in here some of the narratives that you were left with in your own sexual trauma history?
Yeah. So I guess one of the things that I struggled with my own sexual experience was that it wasn't as maybe portrayed on the TV, right? So I wasn't down some dark alley, beaten up. I didn't have a black eye, and it was with somebody that I was in a partnership with at the time. And so much of it, and even our law has fairly recently changed to include rape within marriage, whereas previously, if you were in a heterosexual marriage, there's no such thing as rape. And so, the laws around us and the societal kind of expectation of what rape is, kind of led me to think, well, that's fine then. Like he can do this. And I guess what it left me, some of the things it left me feeling was that, I get less of a say than the other person. And my kind of experience of that didn't matter because the other person's experience mattered more. And even in terms of, who decides? Like, how do we then enter those conversations about consent? How do we enter conversations about being able to talk? I think a lot of difficulty comes from not being able to say words to each other. Do you want to do this right now? Or really tuning into another person and realizing they don't want to do this right now. And being able to prioritize somebody else's needs over your own, when it's quite clear that wasn't what they'd wanted. And I think that's such a minefield. There's so much there that we could talk about. But I guess what it left me feeling is like I was always one down, and that the other person was always one up. And so, that it's interesting as well, because the age that happened, I was 15 when I was raped. And I think, not to say that that's more traumatizing than anything else, because that's not true. I don't hierarchy trauma. I think one of the things that it did do was impact the narratives that I then grew up with. So I didn't have I didn't have an adult foundation to the world. I had a child's foundation to the world, and that these narratives are set in quite young, and that they've been really hard actually to try and do that self as context work around, to kind of add narratives to the story that I think for a long time guided my life. So from a sexual perspective, there's just something else I want to add, which I didn't say in the workshop because it wasn't the focus. And one of the things that really, really felt confusing was that I didn't feel shame for enjoying sex. And I think so often, in our media and people I've come across who've experienced sexual trauma, there is a shame to it. There is a shame of, I liked it, or I had wanted it and then said no. And, there's so many different points at which shame can be experienced. And I found myself in this box of then acknowledging I had been sexually abused, and I didn't feel shame, and that didn't feel right. And so I think there needs to be a space for those things to be held separately as well. That actually sexual abuse isn't synonymous with shame, and people can have a fulfilling sex life, whether that's on their own or with a partner or multiple partners, in any form that they want to, and that shame doesn't kind of have to rule their life, But that was really confusing for me at first, because shame, it felt like everything I saw and read and learned about, that shame was synonymous with having that experience in my history. And as you know, I'm quite open about sex and sexual experience. So, it was a confusing thing to come across.
Thank you so much for sharing your story and for giving voice to your trauma and to the narratives, and also the broadening of the narratives that I see is going on there. It's very inspirational and heartbreaking at the same time, Dawn. One of the things that you were talking about here, that like you were always one down, or the other one, the other person was one up. One of the things that you brought into my life, you and me were doing a workshop together in San Francisco, and for that you brought like a few exercises, and there was one in particular that has gotten a lot of positive feedback. And it was the exercise where you invited people to think about what they like and what they don't like. Could you put some words into this so that the people who are with us listening could get a sense of how you could do some of this work around what it is that we like and don't like, and have this conversation with our clients?
Yeah. So I really like this exercise because this is about you tuning into you, right? So that feels really important to give you a voice. And so you could do this in couple therapy, or you could do this with your partner. And I really like that this is about you, right? Yeah. So it's not, the focus is not to sit there and think, what do we want to do? We're talking solely about you as an individual.
Yeah.
And what can be really interesting then is to do this as an individual exercise and then share it with your partner. You know, these are the things I said, I would really like, or that I would be willing to do with you. And then they can share their things back as well. And that's a really lovely thing to do. So the idea of the exercise was to get a piece of paper and divide it into 3 columns. And one was like, absolutely, yes, I love that stuff. The middle column was, doesn't really bother me, and I'd do it if my partner was interested, or, if I felt like it, but it's not kind of top priority. And the third column is, I'm just not into that. And so, and then you just go through a list of sexual behaviours, right? So that can range from anything at all, like kind of, clothes on touching, to sexual actions that you do to yourself or to others. And in the workshop, you and I kind of read out a whole list of things, didn't we? And just invited people to put those into their 3 columns. And so sometimes it can be, contextual behavioural answer is always, it depends, right? So sometimes it goes in a number of columns, and it's like, well, I'd do that if I was on my own, but never with a partner, or I'd only do that with my partner, but I wouldn't do that on my own. So, there's flexibility in all of this, that you can put that behaviour in any column you like, or more than one column. And why that felt helpful was for us to really tune in, I think, to what we would like to experience. And then, like I was talking about, sharing that with your partner or partners, it just gives you an opportunity. It's an invitation to then experience, I didn't know that about you. Like, in which context would you like to try doing that? And just those things, I think, are really helpful. They evoke conversations between partners that enable you to kind of go in the direction of things that feel important to both of you. But also, very importantly, allow you to go, okay, you don't want to do that? Like, we've never talked about that. And I think consent is such an interesting topic because it's so broad, right? It feels so on the one hand, when we don't talk about sex, consent is like really easy. We kind of assume the other person's going to be up for it, and that, we do these like normal sexual behaviours, and that's okay. But when we really get into consent, it's like, what are you consenting to? Like, you have no idea what's going on in the other person's mind. You've no idea what their fantasies might be. You've no idea what their level of arousal might be. So what do they want today might be different from what they wanted yesterday, or they might want next week. So it's really important for us to talk about things that we want to do more of, and things that we maybe don't want to do at all. It just doesn't feel like we talk about that very often.
And what I really found so liberating was that, so this list that we provided for the audience there, or that one would provide for a client or a couple or etc., the list had kind of a broad list of sexual behaviors. So ranging from what you said, like touching with your clothes on, to behaviors that many people, I think, would categorize as kink or BDSM or etc. So that we are allowing a space to talk about all kinds of sexual behaviors with no judgment, but allowing people to consider whether they like it or, you know, would want this on their menu, sexual menu, so to speak. I really appreciated that the behaviors that people were asked to consider, that was a very broad range.
Yeah. Yeah. And the invitation there is to put most of it in the no category if you want to. Like,
Yeah.
you're free to make that decision, right?
Yeah.
I think what's important is that you're also free to make the decision that, actually, I'd like to try that.
Yeah.
Wouldn't that be exciting? Like, to be able to say, oh, never thought about doing that before, and now somebody's just asked me, am I interested in it? And I kind of am. Like, how cool is that? And I think, again, it comes back to like a deeper conversation then. You know, I listened to something fairly recently, and they were talking, it was a BDSM podcast, and they were talking about slapping. And what I loved was the level of detail. Mm-hmm. So if you were to say to your partner, like, oh, you know, I'd like you to spank me a little bit, we kind of go, oh, okay. Mm-hmm. And it's like, well, that doesn't really tell me what you want. Like, do you want, in that moment, is that more about the domination? Is it more about the physical sensation on your skin? Is it more about the fact that you can feel submissive and just kind of give in to something? There's a whole range of reasons why that might feel appealing. And one of the things that feels really important is to talk about the detail of that. Yeah. So they were talking about, you know, if I was to slap you, is it full hand? Is it hand without the thumb? Is it 3 fingers? Is it 2 fingers? Like, because all of those things would feel very different on your skin. And so that's something that's really important. And if you want to try those kind of behaviours, what's also really important from a BDSM world is repairing afterwards. It's that kind of making sure that you come back together as a consenting couple. And, you know, there might be any kind of soothing, there might be conversation, there might be, you know, a debrief as to what happened. So there's lots in there about the detail. And I think that's what feels very important about our conversations about sex, is that we're not just talking about, I fancy doing this. It's like, okay, tell me about what that means for you. Exactly. Like, what do you want to get from that? How do you imagine that feeling, or what do you imagine me doing in that moment? Yeah. And
the importance of it's not just like that you slap, but it's how you slap if you do slap.
Absolutely.
There's so much detail to be found there. I think I just interrupted you. Please keep going.
I was just going to kind of, it's a curious question, or maybe people want to answer it, but I'm just wondering how comfortable people would feel having those conversations. You know, say for example, you were thinking here now, like, oh, I'm kind of interested in, it might be slapping, it might be anal sex, it might be oral sex, whatever. Like, if you're kind of interested and you've never told your partner that before, like, how comfortable do you feel having a very open, detailed conversation about your sex life with your partner or partners?
And one of the things that you and I have spoken quite a lot about is that sex is not just about 2 or more people. And in fact, we've talked about exploring your own sexuality. Could you put some words into that? We spoke about it just before going on air here. The importance of exploring your own sexuality. Absolutely. So some of this, like, my thinking around this comes from trauma. And actually, how can you, if you've experienced trauma and somebody says to you, especially as a woman, so 70% of women don't orgasm from vaginal penetration. And so if what we see on porn or what we see in magazines is mostly like male fucks female, that's the kind of heterosexual norm in a lot of our media. What becomes really interesting is, how would you even know what good sex is if you've never experienced that? And so kind of exploring your own body, how do you touch yourself, what feels nice, what doesn't feel nice? Do you like using oils or lubricants? Do you like sensations of smell? Do you like, you know, clean sheets, or do you want to be standing up? All the different things that you can explore
feel really helpful to do on your own. And another, even without the trauma, like how often does sex not happen because we're busy, right? And so we kind of go from this very busy lifestyle, and your partner might say or allude somehow that they're interested in having sex, and you're like, I've still got the laundry to do, and I've got to cook dinner, and I need to kind of walk the dog. You know, we're living in this to-do list cycle. And so what can be really helpful sometimes is having time by yourself, you know, saying, just give me 10 minutes. And whether that's whatever that you might do in that 10 minutes, it might be you with some toys, it might be you on your own, it might be you sitting in the bathroom, I don't know, brushing your teeth. But what you're doing is you're connecting with your body. And so you're getting out of this kind of busy, cortisol-driven cycle into a different headspace. And actually doing that on your own reduces the pressure on you. So when you go into that sexual experience, it feels like you're much more in tune with your body. And there's nothing less orgasmic like than being pressured, right? So if it's like, shall we hurry up and have sex? It's just going to feel more pressuring. Whereas actually, if we can kind of slow down and come into our bodies, and you know, we talk about mindfulness a lot, and this is more about bodyfulness, right? This is like, how do you come into your own body and your own sense of sexual being to then engage with somebody else or other people that want to engage sexually with you. And so I think, you know, seeing yourself as a sexual being is a really helpful thing to then bring into any sexual interactions you have with other people, because it will help to give you a voice. It will help to give you knowledge about what you do or don't like, about what you do or don't want to do with other people, and what you do or don't want to do by yourself. So I think those exercises where we're kind of thinking about, oh, where would I put this particular behaviour, really helps you to explore under what context you might want to engage in that or not.
So here's an invitation for people who are watching this, either if you're with us now or if you were catching the replay, to actually consider your own, like, what do you like make your own 3 columns. What would you like? Absolutely, I'd like to do this. This is, and on the middle column being, I could do this under the right circumstances, and the third column being, I am not, I'm not willing to do this. Have a think about this. Can be actually absolutely amazing to contact maybe areas that you weren't aware of, and as you said, Dawn, exploring this with your partner or partners to know more about each other and to add pleasure to your own and others' lives. One of the things that I've also loved about our conversations is that you often talk about sex as kind of a buffet. Could you tell people, the reason why I'm laughing is that because, you know, for me, this was, I knew this, but it wasn't until kind of you told me this, I was like, of course. Like sometimes we're so, like, even though we're working with this, we're talking about this, and we're pretty well educated, sometimes we miss something. And for me, it was just an eye-opener when you spoke about this as a buffet. So would you mind sharing with the audience that?
Yeah, so a simple question, like, well, I'll ask it to you. Like, what's your favourite food?
At the moment, chicken.
Chicken. Okay, we'll go with chicken. So, what's your favourite food is chicken, right? If I give you some chicken tonight, and might be so in the UK we make roast dinners on Sundays, right? It's one of the things we do. Like, if I gave you a roast chicken dinner and you were like, wow, that's awesome.
Love it.
It's like mint, right?
Delicious.
Would you want it again tomorrow?
Yes.
And the day after?
Yes.
And the day after that?
Yes.
I mean, it's really good.
Yeah.
Like, it's nice.
Yeah.
Oh, do you still want it on Monday?
Well, it depends. Maybe I would want steak.
Okay, right. So when we think about sex as, quite often we think about it as this linear kind of hierarchy, and we fall into patterns of, man has to have erection, woman has to be aroused enough for that to work, and therefore we kind of follow this. We might hug, we might kiss, we might touch, we might undress each other, we might do some oral sex, and really the goal is to just get to penetration. And then penetration happens, and here's your roast chicken dinner. Like, it's lovely, right? And so when we start to think about sex in this like linear model, it becomes almost this like staged approach that we have to follow, because ultimately what we're doing is holding, and society quite often holds, that sex equals penis in vagina penetration.
Yeah.
Now, obviously, when we're talking about
and climax, leading to climax, both climaxing.
Absolutely.
Preferably the man.
Well, this is what I was just going to say. When we're talking about other, so when we're talking about gay sex or lesbian sex, there are different statistics around orgasm. So the kind of worst off is women in heterosexual relationships. So we know that they have the least number of orgasms, and quite often once penetration has finished, like ejaculation has happened or orgasm has happened for the man, orgasm and ejaculation are not the same thing, but quite often they can be. So once ejaculation has happened, it's kind of, game over. And so women often don't experience the same pleasure from that as maybe the male partner would. And so what we wanted to do in the workshop was to give people more of a variety, right? Like, what is on your sexual menu? Like, instead of hugging or holding hands being down here on the hierarchy, what happens if we just say, wow, that's really cool, we just did a sexual behaviour, right? What if we were then able to talk about, instead of kind of something leading to a goal, like orgasm, what if we were able to talk about spending quality time together as us? You and I in a space together, spending some quality time together. And so that might be hand holding, it might be kissing, it might be touching, it might be penetrative sex, and it might not include penetrative sex at all. And so orgasm might happen. It also might not. Like, how wonderful is that? To have a sexual experience where maybe neither of you orgasm, not because you're bored or because you're distracted, but because that isn't the goal. And just so what we start to do then, a little bit like when we talk about values in ACT, we talk about, like, do I want to go to San Francisco? Okay, so that was, I'm sure it's a great place. I've been, it was lovely. Do I want to go there? But that's a very specific goal. If I talk about, actually, a value of mine would be to travel and see the world, like, oh my, I've suddenly got all these other places to go and explore and, see them, see me in those places. And that's what we're doing with the buffet menu. Do you want a roast chicken dinner every night? Or actually, do we add in some variety? Do we add in some other experiences? And we don't actually have to have an end goal. The purpose of this time together is for us to do what we're both choosing to do, or all of us are choosing to do, if you have more than one partner. And that can also be true of that time being by yourself, right? That actually you don't have to make yourself orgasm. You could play with something new. You could go into a different room. You could experience different positions. And all of this is about tuning into yourself and your partners, if you're with partners, tuning into yourself and really thinking about what you like and what you want more of in your sexual experiences.
it makes so much sense. And for me, this was kind of an eye opener, because I feel like in my own life, I was like, if like sex is penetration or something like that, like I had a very small narrative about what was defined as sex. And when you and I had these conversations, I was like, oh my God, we can totally broaden this, and we can add function to a variety of behaviors, and they're now serving, like, we can expand on the buffet, and which greatly impacted myself and my connection to my partner or partners. And so for me, it was an eye opener. And I know that on the workshop that you and I did together, we actually had people come up, didn't we, after the workshop, and saying, oh my God, this has been so liberating to me, because I now have a broader sense of what can serve as a sexual behavior with my partner or partners. And it was just like liberating for people. So it makes so much sense. It makes so much sense. I just want to take a second to just say that we have people commenting here, just so that people know that we're with them. So just hang on a second, Dawn. So I just want to say we have Patrick here. Hello, lovely ladies, says Francesca. Francesca, our friend from Italy, sitting in Finland. We have Ray. Ray Owen is here, our good friend. Magnus Maeve is here, Beverly is here, Anne is here, Danish woman in France, Manabu is here, Ancha is here, Anna is here, and then our good friend Ray says, that's great. Context, detail, behavior, and function apply to detail of sexual actions. Never thought of that before. I love that, because, again, there's so much of this, like, now that you say it, and in our conversations, like, it's suddenly obvious. But it is because we're having these conversations. I think this is so important. So we've seen so many people, and you and I are talking to so many practitioners who find it so awkward to have these conversations with each other, with their friends, with their partners, and even with their clients. So this is such an important conversation to have with the people around you, both off and on work. You were saying before I interrupted you, do you remember where you were going?
What was I going to say? No.
One of my specialties today is to interrupt.
That's all right. No worries. I can't remember what I was going to say. I will come back to it if I do.
You'll come back to it.
Yes.
So I hope people really enjoy that metaphor of the buffet, and thinking about broadening that, and having a wider narrative about what could be sexual behavior. One of the things
I do remember.
Come on. Give it to me.
Woo! What I was going to say was, it also doesn't have to be like private. So, you can experience like a sexual connection with your partner whilst you're out.
Yeah.
You can sit here now fantasizing about your partner, and you are being a sexual being, right?
Yeah. Yeah.
And so when we talk about this buffet, like, I think about myself as a sexual being quite a lot of the time. And if I was to draw out a pie chart, the amount of time I actually engage having sex or a sexual act of some description is probably quite a small percent of that. But me as a sexual being, thinking about my likes, my dislikes, when I talk to a client, obviously I can't help but my mind think, do I like that? Do I not like that? So here I am kind of tuning into my own sexual being all of the time, like a lot of the time. And I think that's really exciting, because if for some reason, whether there's dysfunction, whether there's trauma, whether there's just a busy life, if you can't connect with your partner as often as you want to sexually, or there's a difference in sexual drive, knowing that you can be connected in a sexual way through talk, through sharing erotic fiction, through sharing your fantasies, through doing these kind of exercises together, sex then doesn't become penetration.
Yeah.
Yeah. And so it
Loving
just
it.
becomes this really broad, like, you know, massaging feet in front of the TV is a connecting, intimate action that you can do together,
Yeah.
right?
Loving it.
That was my point.
That was it. That was it. Why do you think, Dr. Johnson, why do you think it is that clinicians, practitioners find it so hard to talk about? Like, why is this difficult? Why is this a difficult topic? Why do you think?
I think there's a load of reasons for that. I think one reason is that society just doesn't talk about this.
No.
So, like our own sexual education, I think is something for us to reflect on. Like, where did we get that sexual education? And actually, what even was it? You know, sex education, which is bizarre because it's nothing to do with sex. For girls, so I can only speak from the UK. For girls, sex education is learning about periods. And it's not even learning about periods in terms of the physiological, biological things happening to you. It's learning how to manage your period so you can keep it as quiet as possible, right? That is not about sex. You can have sex when you're on your period if you want to. So this is nothing to do with sex. And a lot of education is don't get pregnant. And so the pressure that comes with, certainly for kind of teenagers, thinking about how do I just avoid being pregnant because otherwise I'll be, you know, socially outcast. And so there's so much pressure and negativity around sexual exploration to the point where certainly for girls it's minimal, if at all. And for boys, quite often it comes from other sources. You know, quite often heard people talk about their experience of finding porn. And so, you know, that's where they get their education from. And that's not the most helpful. You know, that's not really what women want or what another partner might want. And so thinking about like what our education and how do we help people to be more educated. I think along with that, we don't learn about anatomy, which is bizarre. Like, how do you know how to touch somebody if you don't know what their anatomy is? And there's a fantastic poet called Holly McNeish. She's in the UK, and she wrote something on Instagram the other day, and she was like, I'm paraphrasing now, but she said something like, I don't understand why even like creams for women don't use the right language. It's like for external use only. So this is something like a thrush cream or something, like for external use only. And her question was, do you mean like external or like inside the labia, or like I'm not allowed to say labia, or in, you know, like can I put it inside my vagina, or can it not touch like the inside of the vulva? Like, why can't you tell me where I'm supposed to put this cream? So what does external mean? You know, and we can't even talk from a medical perspective. We can't even talk about our bodies in that way. And so when you think about why, you know, when you become a clinician, you're still a human being, right? You've still come into that with all of your own history, your education, your learning, and your own experiences, your own discomfort, your own shame. And so it's really hard to then, as a clinician, kind of be able to say something like penis or vulva. It's like we just don't use that language at all. And I think there's another, it feels to me like there's also something about our genders here, which I want to be careful because I want to keep this as broad as possible. And so some of my experience of talking to some male therapists has been, I don't dare. You know, like as a male therapist, talking to somebody who's been traumatized is fine. Then asking them about their sex life, whoa, that doesn't feel so comfortable. And again, like, where does that come from? So yes, it comes from a beautiful place of wanting to look after somebody, and it's not opening a conversation that needs to be opened, right? And so thinking about your own views of this, And what would it feel like for you to have a conversation with a client? You know, what shows up as soon as I say that? Is there like a retraction of I couldn't do that? And if so, like, what would that be about? So I think there's a number of barriers to kind of people talking about it. Yeah.
I had like, so I, you know this because we know, you know a lot about me, but when I had like just recently, so I have two boys in the house. I have several boys, but two of them are my sons, and they're teenagers. And so I had me and my mom were walking the dog in the forest. And so my youngest son, he's just 15 and he has a girlfriend. And my mom, she said, and I have everybody's permission to share this, but my mom, she said, do you think they're doing it? And I was like, Mom, what does doing it mean? Like, do you think they're doing it? And I was like, you can't even say the words. You are calling it and doing it. And I said, like, I wish you'd talk to me about this, because nobody talked to me about these things. And I'm just thinking about how much I talk to my children about this. And they're like, for the first times we talked about this, they were like ready to, fall into a black hole in the in the floor and just disappear. And now I'm noticing how my older son, who's 19 at the moment, he'll talk freely and openly about sex. And one of the things I think is one of the reasons why I think he's doing is because he had a space where that was allowed. He was asked questions, he was allowed to think about what he liked and he doesn't like, and naturally it hasn't been an equal conversation. Is in that sense, I'd never shared details from my sex life with my son, because we could talk in a broader perspective. I wouldn't share stories from my sex life that I've shared with you, and I think this is important because I've had so many practitioners, clinicians ask me, well, do you share your sex life with your clients? No, I don't. I share it with Dawn. I share it with my other friends. But I bring my own sex life into the therapy room as a way of connecting, as a way of allowing us to give language to this kind of buffet and etc. So there's a difference between asking therapists to share their own preferences and their own experiences and allowing people a space to share this. So just noticing how, even for me, I think I'm kind of, I will easily talk about this. I'll easily use self-disclosure and pretty open about it. But I was never taught this. Like, it's something that came very late. I was never taught this. I don't have a learning history of that. And I'm pretty passionate about teaching my children and the people around me or inviting them, not teaching, but inviting them to have this conversation about sex. Were you taught, like, did your grown-ups talk to you about this?
Never.
Mm.
And there's also something I was thinking about, because I thought you might ask me about why I feel passionately about this topic, and part of that comes from me and my history, right? And so one of the things that I needed to do after I'd been raped was to go to a sexual health clinic, and I was 15 and nobody asked me if I had consented. Nobody. And so everybody just talked to me like I was taking a paracetamol for a headache, right? Like, nobody asked me if I was okay, if I'd consented, if I wanted to do that again, if I knew what I was doing, like nothing. And it was kind of like, oh, okay, like the doctor will see you in a minute, just go and sit back in the waiting room. And then I saw the next person and they put me back in the waiting room, and then I saw a doctor and they gave me some tablets, and then I was on my merry way. And it was the most bizarre experience, because I'd basically gone in there like stressed like you wouldn't believe, feeling like I couldn't say anything to anybody about this because it shouldn't have happened. And like, what do you do with that? You know? And I remember you and I talking about this many months ago. And it's like, you know what? If I can do nothing else for people, I will damn well give them a space to speak. Like, if that's all I can do, I will damn well give them a space to speak. And I think that's so important, because what you've done for your boys is enable them to come to you, right?
Can I just ask,
It's
how did you, I'm deliberately interrupting you. The other times it was just me, you know, but this time I'm deliberate. What does it feel like to say what you just did? I will damn well give people a space. What does that feel like?
I feel really emotional. I feel
Yeah.
really emotional. And that's passion, right?
Yeah.
That's because it's so important. Like, how can we not do that? Like, from our own sense of shame, or from this feeling uncomfortable, like, how can you shut somebody down? Like, I was talking to nurses and doctors, you know, but the emotional side of that was just irrelevant to them. It felt irrelevant to them. You know, and that was my experience of looking after my body, was like, the emotional impact of that just doesn't matter as long as, you know, you're safe and you're not pregnant. So I think being able to say that now, from my perspective, is like, well, I will, if I can, I will.
From where you are right now, if you could go back and offer this teenager who sat there where people were treating it like have a paracetamol and go home-ish, what did she need? Like, what did that girl need?
I think she needed to be heard.
Yeah.
And I think actually what came out of such a lot of that, like, that relationship lasted for 10 years.
I know.
And I know that for me, that's where my shame comes from. Like, hello, it's just joined us. That's where my shame comes from, because there are so many examples, not of rape, but of feeling disempowered, feeling like I was one down. There were so many examples of that from a domestic abuse history, that actually that's where my shame comes into the room, you know, full and frank. And I think actually she needed to be heard. She needed a space to be able to say, like, this doesn't feel okay.
Yeah.
And it's like, yeah, because it wasn't. You know, and wow, like, if we can do that for people, how incredible is that? Not because we're there to fix, not because we're there to judge, not because we're there to tell them what to do. I wouldn't have wanted somebody to say, leave him. Because if somebody had said, leave him, I'd have gone, no, he didn't mean it like that, or he was just upset, or he was just this, that. I would make excuses till the cows came home. So if somebody had just told me to leave him, it wouldn't have been helpful. But if somebody had listened, if somebody had given me a space where I could say, I'm not liking this, that would have been very helpful to me, right? From a sexual perspective and from a relationship perspective.
Yeah.
And so I think the communication about sex or relationships is just as important, you know?
What was it like for you to just say now, that was not okay?
It's a bit... I can't say that was not okay without being kind. And that's difficult. Because that's coming face to face with my shame, right?
Yeah.
So that's hard. And it's important because this stuff matters, you know? This stuff matters for so many people.
And so I'm shaking. I'm blown away again by you, Dr. Johnson. And one of the things that I'm noticing is that the passion you bring into saying, I'll damn well offer people a space where they can talk about this. And tonight you just did. You offered a space for me. You and I are talking about this, and I know that you are affecting the people who are watching this. I know that you should see the hearts coming in. People, please keep sending the heart for Dr. Johnson. I just want to say that I have a comment here from, just wanted to bring in the people here. There is no one in a school that is experienced or qualified to teach them about sex. Doctors have no training in sexuality other than from medical model. Children would prefer their sex education to come from their parents, but parents prefer the school to give it to them. Yes. My mother did this. Well done, Ricky. This is Honora. I'm guessing you're talking about how we talked about sex at home. My mother did the same with me, and that made me comfortable talking about sex as a therapist. Great. That is from Barbara. And I have Helen. My parents never mentioned it at all. I had so much shame around sexuality. Yes, and sex and sexuality. Sarah says, thank you. Francesca says, awesome talk. I can so relate with stigma and silence on sex. Also coming from a Catholic background. Now I already sent a cheeky text with the sexual buffet metaphor to my boyfriend. Definitely going to use that. You go, girl. Such an important perspective. Bringing sex and sexuality into our work can provide exactly this opportunity to feel heard. Beverly, thank you, Honora, for that. Beverly says, thank you so much for your vulnerability, Dawn. This is definitely a courageous conversation and such an important one. Anne is sending love. Hannah is saying, thank you so much. Now I'll bring this into my practice. So I'm gonna expose you in a way that I haven't asked your permission, and so I'm hoping you will appreciate the gesture of when I spoke to you about, like, what would you like to come on here and do cocktails and courageous conversations with me? Your first response was like, I don't think I have something, particular to offer. Something like that. I'm paraphrasing. Something like that. And I was like, hello, you are such an inspiration. And so here's an invitation for you, Dawn, to go back to the comments and now, and as they keep coming in, and just noticing what a difference you are making for people. You're damn well offering us a space to talk about this. And you are impacting so many lives by coming in here today and talking about, and now we're just touching, I know, like a fragment of the conversations that you and I have had about this. You and I, we're actually talking about starting a podcast, aren't we? So people in the comments, if you would want to see Dawn and myself doing a podcast talking about sex, let us know in the comments. That will probably help us get going. But just wanted to acknowledge. And so this is why I hope people now see, this is why I love and adore you, and I'm blown away by you every time you open your mouth and do something. Because not only are you very well educated, you are such a courageous person, such a sweet and kind person, and you are offering people a space to talk about this in a way that is just so liberating. So I'm just in awe of you, Dawn, really. If the 15-year-old could see you now, having done this webinar, this talk with me, having a cocktail, chatting to people, touching their hearts, like what would she say to you right now?
I think she'd say thank you.
What are you experiencing right now in this very moment?
Tears. I knew you'd do it. Yeah, I think you should say thank you. Should say thank you because I think, my work isn't all about sex by any stretch. Like, ACT is my main approach, and I bring that into work when it feels relevant to the client, right? But there's also something obviously very relevant to me, and I've done a lot of work around that for myself. And I think she'd say thank you, because I've done something, I think I've done something useful. It's post-trauma, isn't it? You know, it's that post-trauma recovery stuff. And so I've done something useful with my experience. Like, no one wants to experience that. It was shit. And it was shit for so long. And like, my only choice now is to do something with it, right? There's no other choice.
And with that, like, right now I want to extend this conversation for another 74 hours. And so you'll be back here. If willingly agreed to do so. And people who are watching this, I hope you see what I see when you are witnessing and interacting with the lovely Dr. Dawn Johnson, my wing woman, my, I think, soulmate, and I have so much I am in loss of words. So thank you. To those of you who are with us, thank you for all the comments. Thank you for your vulnerability. Thank you for sitting with us, sharing. For those of you who will watch this afterwards, thank you again for coming in, watching it. Please keep putting your hearts and love in the comments, because Dawn and myself will see this. Dawn Johnson, you are one of the most courageous people and inspiring people I know, and I am honored that you chose to come in here with me and with the group, and would love to have you back, and I cannot wait to start a podcast with you.
Yay! Lovely.
Lovely.
And cheers.
Cheers. So, yes, cheers everybody, and thank you so much for coming, and have a lovely, we wish you a kind and gentle and lovely evening, and we hope that you will keep talking about sex with us and with others. Thank you so much, everybody. Bye.
Bye. Thank you.